NewsNation crews were there as the first shipments rolled out of a vaccine distribution center in Michigan. FedEx employees loaded a semi-truck with doses of the vaccine. Many of those trucks left Portage, Michigan, just outside Kalamazoo. Drivers transported the vaccines to Gerald R. Ford International Airport in Grand Rapids. Now the planes were bound for Memphis, where FedEx Global Hub is. From there, vaccines will be sent around the country. NewsNation got an inside look at this distribution plan.
Big day. This is it, right? This is pretty dang exciting.
It's the moment many have been waiting for.
The fact that it's coming out of Grand Rapids and the Ford Airport today is a big deal, right? And we're just incredibly honored to be a part of it.
Stephen Clark is the director of commercial development for the Ford Airport. He says from Michigan, the vaccine doses will be sent on a FedEx plane to their global hub in Memphis, then sent across the United States.
We'll see distribution coming through here quite frequently.
Today is a huge day for us. We've been doing a lot of planning.
Troy Richardson is the president and CEO.
Many months of work have finally gotten an approved vaccine. Today we're here to see that the vaccine gets shipped out and gets into distribution.
The vaccine should get in the hands of medical staff within the next few days, a long sigh of relief at the end of a tough year.
For many of us in the industry, it's personal. We've all known someone who has been laid off, reassigned, furloughed, whatever have you. And so today is a day where it's our opportunity to go after this virus with what we do best, which is connect the world, and in this case, vaccines, to the community.
The vaccine must be kept at an ultra-cold -94 degrees. Officials will deliver the doses from distribution centers to hospitals and other storage locations that are equipped with special freezers. Pfizer is supplying containers filled with dry ice. They also have a GPS sensor that monitors the temperature for each shipment.
Top U.S. health officials answered questions about the rollout this morning. In an interview with CBS, HHS Secretary Alex Azar talked about the timeline for getting Americans immunized.
We'll be getting more and more Pfizer product, and we've got a 12.5 million of Moderna product, assuming that we get approval at the end of this week on Moderna that will ship out very soon thereafter. So 20 million vaccinations this month, and then we think we'll be up to 50 million total vaccinations of people by the end of January, and 100 million shots in arms by the end of February, just with the Moderna and Pfizer vaccines.
In another interview with NBC, the director of the National Institutes of Health, Dr. Francis Scott, talked about how the vaccine will impact transmission in the coming months.
We know from the phase 3 trials of Pfizer and Moderna's vaccine will be discussed on Thursday in a public meeting, and it looks very similar, that this is very effective, 95% in preventing symptomatic illness. But we don't know whether somebody who had the vaccine could still acquire the virus without any symptoms and potentially be contagious to others around them. That is an urgent question to discover. It will take us a couple of months to figure that out, and there's still some debate about the ideal design of the studies to do that. What that means is, if you've had the vaccine, and people are going to start getting it this week, you still need to wear the mask. You still need to think of yourself as potentially contagious, even though you are protected from getting sick at a very high percentage of certainty. Masks are still going to be part of our life. We need to recognize that and not step away or start to drop our guard.
These shipments could not come at a more critical time. The latest numbers from Johns Hopkins show confirmed cases here in the U.S. now up to 16.2 million since the pandemic began. Health officials report an additional 219,000 cases yesterday, down from the day before. Deaths are now nearing 300,000 after an increase of 2,300 yesterday, which is also a decrease.